You know that moment when you're sitting in a waiting room back home, staring at a clipboard full of forms, and you think, wait, I haven't even seen a doctor yet and I already owe someone money? Yeah, I've been there. We've all been there. Now picture this. You wake up in a foreign country, you feel terrible, you walk into a clinic, a doctor sees you, runs tests, gives you medication, and you walk out without paying a single cent. Not because you're rich, not because you have some platinum insurance card from your employer, but because in that country, taking care of you is just what they do. I'm Julia, and if you've been following me for a while, you know I travel constantly. For love, for life, for the kind of experiences that genuinely change how you see the world. And after living in and visiting dozens of countries, one thing keeps hitting me over and over again. The way a country treats its sick people tells you everything about its values. Today we are talking about 5 countries where the healthcare is not just free. It is cutting edge, compassionate, and covered for everyone. And spoiler alert, one of them might be your next home. Let's get into it. Country 1, Germany. Okay, so we are starting in Germany, and I want you to understand something right away. When people talk about European healthcare, Germany is often the example that even economists who don't agree on anything will quietly nod at and say, yeah, that one works. Here is why Germany is fascinating to me as both a traveler and someone who has spent real time living there. The system is built on something called statutory health insurance, and it has been around since 1883. Yes, 1883. Otto von Bismarck, of all people, decided that a healthy workforce was a national priority, and what started as a political calculation more than a century ago has evolved into one of the most sophisticated health systems on the planet. So how does it actually work? If you live and work in Germany, a portion of your paycheck goes into a health insurance fund called a Krankenkasse, and your employer matches that contribution. It is not optional. It is not something you sign up for when you feel like it. It is just part of the social contract. And here is what that contribution gets you. Access to over 2,000 hospitals, more than 300,000 registered physicians, dental care, mental health services, prescription coverage, maternity care, physiotherapy, and so much more. Now let me talk about the technology for a second, because this is where Germany genuinely blew my mind. Germany has been rolling out a nationwide digital health infrastructure that includes something called the Elektronische Patientenakte, the electronic patient record. By now, most insured residents have access to a digital health file that follows them from doctor to doctor, clinic to clinic. You are not carrying around paper files or trying to remember what medication you were prescribed 3 years ago. The system knows. Your doctor knows. And you have access to all of it from your phone. What I love about spending time in cities like Berlin and Munich is how normalized this all is. Nobody makes a big deal about going to the doctor. There is no anxiety about affording a visit. When a friend of mine, an American expat living in Hamburg, told me she had gone to a specialist, gotten an MRI, received a diagnosis, and left the building without any payment discussion at all, she literally teared up telling me the story. She said it felt like she was being treated like a human being, not a transaction. Germany also has some of the highest hospital bed counts per capita in the world, and it consistently ranks in the top tier for cancer treatment outcomes, cardiac care, and neurological surgeries. The waiting times, which are a concern in some universal systems, are addressed here through a dual system. You have public insurance, but there is also private supplemental insurance available if you want faster specialist access or a private room. The public system itself, though, is comprehensive enough that millions of Germans never bother with the private add-on. And then there is the mental health piece, which I want to acknowledge because it matters. Germany covers psychotherapy under statutory insurance. You can see a licensed therapist sometimes for months or even years, with coverage included. That is not a small thing. That is a country saying, your mind matters as much as your body. For expats, and I've talked to so many, the process of enrolling is genuinely straightforward if you are employed. You register, your employer handles the payroll deduction, and you receive your health insurance card. Done. The biggest complaint I hear is the bureaucracy of the initial registration paperwork. And honestly, after years of traveling, I will take German bureaucracy over an American hospital bill any day of the week. Germany is also constantly investing in medical research and pharmaceutical innovation, which means the treatments available are not second tier. You are not in a system that is cutting corners to stay affordable. You are in a system that is well-funded, well-regulated, and deeply serious about its quality of care. If you are thinking about relocating to Europe, Germany is not just a practical choice. It is a place where you will feel taken care of in a way that is hard to explain until you experience it yourself. Country 2, Japan. From Germany, let's fly east, way east. Because the next country on our list is Japan, and if Germany impressed you with its efficiency, Japan is about to redefine what you think healthcare can look and feel like. Japan has one of the highest life expectancies in the world. Women in Japan live on average to about 87 years, and men to around 81. That is not an accident. That is the result of a healthcare culture so deeply woven into daily life that it almost feels like a different relationship with the human body altogether. The Japanese healthcare system is based on universal coverage, and it has been since 1961. Every resident, Japanese citizen or registered foreign national, is required to be enrolled in health insurance. There are two main tracks. If you are employed by a company, you are covered through your employer's insurance scheme. If you are self-employed, a student, or not working, you enroll in national health insurance through your local municipality. Either way, you are in the system. And here is the part that still makes me catch my breath every time I think about it. In Japan, patients typically pay around 30% of their medical costs at the point of service, and the insurance covers the remaining 70%. But, and this is critical, there is a monthly cap on out-of-pocket spending. If your medical costs in a given month exceed a certain threshold, the government covers the rest. So even if you have a major surgery or a serious illness, you will never be financially destroyed by it. Never. Now let's talk about what that healthcare actually looks like, because Japan is not just universal, it is extraordinary. Japan has more MRI machines and CT scanners per capita than almost any other country in the world. The density of diagnostic imaging technology here is genuinely remarkable. When you walk into a Japanese hospital, you are walking into a facility that takes precision medicine very seriously. I spent several months living in Tokyo, and one of the things that struck me most was the culture around preventive care. Annual health checkups, called Kenshin, are built into working life. Many employers are actually legally required to provide them. These checkups screen for everything from blood pressure and cholesterol to early-stage cancer markers. Japan catches things early, which is a huge part of why its health outcomes are so strong. The cancer survival rates in Japan, particularly for gastric and colorectal cancer, are among the highest in the world. This is not luck. It is the result of systematic early detection combined with world-class treatment facilities. Japan has pioneered techniques in endoscopic surgery, robotic-assisted procedures, and proton beam therapy for cancer treatment that are attracting international medical tourists. Something else I want to mention because it always comes up when I talk about Japan, the pharmacies. There are pharmacies everywhere in Japan, and they are staffed by actual pharmacists who take their time with you, explain medications in detail, and follow up on treatment plans. The relationship between the pharmacy and the clinic is integrated in a way that feels genuinely coordinated, not just transactional. Country 3. France. All right, we are heading back to Europe now, but this time to a country that has been ranked by the World Health Organization as having the best overall healthcare system in the world. That ranking is from a while back, but the fact that France achieved it and has maintained its reputation ever since tells you everything. France. Oui. The French healthcare system is called Sécurité Sociale, and it is the backbone of French social life in a way that goes beyond just medical care. It covers health, maternity, disability, and old age. For our purposes, we are focusing on the health component, which is called assurance maladie. And let me tell you, it is as impressive in reality as it sounds on paper. Here is how it works. The French system is a reimbursement model, which is slightly different from what we have been talking about. You visit the doctor, you pay a modest fee. We are talking somewhere in the range of €25 for a general practitioner visit. And then the insurance reimburses you for a significant portion of that cost. If you have supplemental insurance, which most French people do through their employer or a private mutual policy, you often end up paying very little or nothing out of pocket at all. The supplemental insurance piece can sound complicated, but it is standard and affordable. The French government has even created a system called the Complémentaire Santé Solidaire for lower-income residents that provides top-up coverage for free or at a very low cost. The goal is simple. Nobody should avoid medical care because they cannot afford it. Now, the technology. France is home to some of the most respected hospitals and research institutions in the world. The Assistance Publique, Hôpitaux de Paris, manages 39 hospitals in the Greater Paris region alone, and they are extraordinary facilities. France is a leader in oncology, cardiology, transplant medicine, and rare disease research. The Institut Gustave Roussy, a cancer research center just outside Paris, is consistently ranked among the top cancer centers in all of Europe. These are not institutions that exist for the wealthy. They are public hospitals. Your assurance malady card gets you through that door. What I find particularly beautiful about France is the attitude toward time in healthcare. French doctors are known for actually spending time with their patients. The consultation is not 5 minutes of checking boxes. There is a tradition of listening, of discussing, of treating the person, and not just the symptoms. It is a more humanistic approach than what many Americans are used to, and it shows up in patient satisfaction data consistently. The prescription system in France is also worth mentioning. Medications in France are heavily subsidized. Many common drugs cost just €1 or €2 with a prescription. Pharmacies are everywhere. That iconic green cross is part of the visual landscape of every French city and town. And pharmacists are considered frontline healthcare providers, not just pill dispensers. They can advise on treatments, monitor chronic conditions, and refer you onward when needed. Mental health care has historically been an area where France has been catching up compared to its physical healthcare excellence, but significant investment in psychiatric services and teletherapy platforms is changing that. The conversation around mental wellness is shifting in France, and the healthcare infrastructure is following. For expats, France has a registration process for assurance malady that requires some paperwork and patience. Again, bureaucracy is a theme in Europe. But once you are in the system, you are genuinely in. Many American expats in Paris have told me that the experience of French healthcare fundamentally changed how they feel about health as a concept. One woman I met had been living with a chronic autoimmune condition that had cost her tens of thousands of dollars a year in the United States. In France, her treatment, which included specialist visits, regular blood work, and biologic medications, cost her a fraction of that amount. She described it as having a weight lifted that she had not even realized she was carrying. And there is something poetic about getting world-class healthcare in a country that also gave the world Monet, Camus, croissants, and the concept of joie de vivre. Taking care of yourself is not a luxury in France. It is part of living well. And the system is built to support exactly that. Country 4, South Korea. Now we are going somewhere that genuinely surprised me the first time I understood the scope of it, and I think it is going to surprise a lot of you too. We are going to South Korea. When most people think about South Korea, they think about K-pop, skincare, incredible food, and the dizzying energy of Seoul. What they do not always think about is healthcare, and that, my friend, is a massive oversight. South Korea achieved universal health insurance coverage in 1989, remarkably fast for a country that was still developing economically just decades earlier. The system is called the National Health Insurance System, and it is administered through a single insurer, the National Health Insurance Service. Every single resident of South Korea, including registered foreign nationals, is required to enroll. No exceptions. The premiums are income-based and split between employees and employers, similar to the German model. For lower-income individuals, there is a medical aid program that covers those who cannot afford premiums. The result is a country where, regardless of your financial situation, you can see a doctor. But here is where South Korea goes, from impressive to genuinely jaw-dropping. South Korea has invested so aggressively in healthcare infrastructure that it now boasts some of the most technologically advanced hospitals in the world. Severance Hospital in Seoul, Seoul National University Hospital, Samsung Medical Center. These are not just national institutions, they are global ones. Medical tourists fly in from across Asia and beyond, specifically to receive treatment at these centers. South Korea is a world leader in robotic surgery. The adoption of the Da Vinci surgical system and other robotic platforms here has been faster and more widespread than almost anywhere else. Minimally invasive procedures that require long wait times in other countries are routine in Seoul's major hospitals. The precision, the recovery times, the outcomes, they are exceptional. Digital health in South Korea is also at a level that I think most of the world is still trying to catch up to. South Korea has invested in AI-assisted diagnostics, with artificial intelligence tools being used in radiology to flag anomalies faster and more accurately than human reviewers alone. There are hospitals in Seoul using machine learning to analyze pathology slides, predict patient deterioration in intensive care units, and optimize treatment plans for complex conditions like cancer. The country also has a phenomenal pharmacy culture. Pharmacies are dense and accessible, medications are affordable, and the integration between hospitals, clinics, and pharmacies is smooth. South Korea has a tiered clinic system where you start with your local clinic for general care, then get referred to a larger hospital if needed, and then to a major medical center for complex cases. The referral pathway is efficient and generally respected. Now, what does this cost you? Out-of-pocket costs in South Korea are higher than in some European countries. Patients typically pay 20 to 60% of costs depending on the service, with insurance covering the rest. However, there is an annual out-of-pocket maximum, and major illness catastrophic coverage kicks in to protect people from financial ruin. For common medical visits, the actual amount paid is extremely modest by American standards. Something I have talked about with expats living in Seoul is the sheer speed of the system. You can get an appointment the same day in most cases. You can get lab results back in hours, not days. You can have an MRI scheduled for the next morning if your doctor thinks it is necessary. The throughput of the system is extraordinary, partly because there are a lot of hospitals and a lot of doctors, and partly because the administrative overhead is streamlined by that single-payer structure. The South Korean government has also been proactive about extending dental coverage, mental health services, and long-term care for the elderly, areas where the system had historically been thinner. These are active, ongoing improvements, which tells you this is a system that is not resting on its achievements but actively evolving. For anyone who is thinking about teaching English in Korea, working remotely from Seoul, or building a life in one of the world's most exciting cities, knowing that you are stepping into a healthcare system of this caliber is genuinely reassuring. South Korea is not just high-tech, it is high care, and it is for everyone. And finally, we arrive at the fifth country on our list, and it might be the one that makes the most intuitive sense for someone thinking about quality of life in a comprehensive, holistic way. We are in the Netherlands. The Netherlands has one of the most sophisticated and consistently admired healthcare systems in Europe, and it operates on a model that is genuinely interesting because it is not purely public in the way that, say, the United Kingdom's National Health Service is. It uses regulated private insurance, but with so many protections and requirements built in that the outcomes look and feel a lot like a public system for the people living inside it. Here is how it works. Every resident in the Netherlands is required to purchase basic health insurance from a private insurer. The government sets the baseline of what that insurance must cover, and that baseline is extremely comprehensive. General practitioner visits, hospital care, specialist referrals, mental health treatment, maternity care, prescription drugs, and more. Insurers are required to accept every applicant regardless of pre-existing conditions. They cannot charge more based on your health history, and they compete on service quality and administrative efficiency rather than on coverage restrictions. The government provides a healthcare allowance, a monthly subsidy, to lower-income residents so that the mandatory premium remains affordable. Nobody falls through the cracks because of cost. And the premiums themselves, by American standards, are remarkably low for what they cover. The Netherlands also has a compulsory deductible, a yearly amount you pay before insurance kicks in for most services. General practitioner visits are exempt from this deductible, which is deliberate and important. The country wants you to see your family doctor regularly, without any financial hesitation, because catching things early costs everyone less in the long run. It is a smart policy design, and it works. Now, the quality of care. The Netherlands consistently ranks near the top of European healthcare quality indices. Dutch hospitals are modern, well-equipped, and staffed by highly trained professionals. The country is home to excellent research universities and medical schools, Utrecht, Amsterdam, Erasmus in Rotterdam, and the healthcare system benefits directly from that academic and research environment. The Netherlands has been at the forefront of digital health adoption. Electronic health records are standardized and interconnected. Telemedicine is widespread and normalized. The Dutch have embraced health technology in a way that does not feel like technology for technology's sake. It feels purposeful and patient-centered. One thing that genuinely distinguishes the Dutch system is the role of the huisarts, the family doctor or general practitioner. In the Netherlands, your GP is the gatekeeper and coordinator of all your care. You register with a local GP, and they know you. They follow your health over years. They refer you to specialists when needed and follow up on what happens. This relationship-based model of primary care produces better outcomes than systems where patients float from specialist to specialist without anyone tracking the whole picture. Mental health care in the Netherlands is integrated into the basic insurance package in a meaningful way. Short-term therapy, typically up to around 12 sessions, is covered under the basic plan. For longer-term treatment, coverage is also available through the system. The Dutch have a relatively open cultural attitude toward mental health, which has made the integration of psychological care into mainstream medicine easier than in many other countries. The Netherlands is also extremely expat-friendly. English is spoken fluently by the vast majority of Dutch people, which means that navigating the healthcare system does not require you to learn a new language first. You can register with a GP, understand your insurance documents, communicate with your pharmacist, and advocate for yourself in medical consultations, all in English. For many Americans or Canadians thinking about relocating to Europe, this is a huge practical advantage. Amsterdam, Rotterdam, Utrecht, The Hague, these are all cities with dense healthcare infrastructure and real community for international residents, and the broader Dutch quality of life, cycling culture, excellent public transit, beautifully designed urban spaces, strong work-life balance, pairs with the healthcare system in a way that just makes living there feel sustainable, like a life that is actually designed for human beings. One more thing I want to say about the Netherlands because it reflects something I care about deeply as someone who writes and talks about relationships and well-being. The Dutch concept of gezelligheid, that untranslatable sense of coziness, togetherness, and warmth, extends into how institutions in that country are designed. The healthcare system is not cold, it is efficient, yes, but it is also built on the assumption that patients are people and that doctors are partners in health, not gatekeepers behind a billing department. When you know you can get help when you need it, without catastrophic financial consequences, without weeks of waiting, without the exhausting bureaucracy of prior authorizations and insurance denials, you carry yourself differently, you live differently, and I think that matters more than we often give it credit for. Conclusion. So there you have it. Germany, Japan, France, South Korea, and the Netherlands. 5 countries where high-tech, universal healthcare is not a privilege reserved for the wealthy. It is a promise made to everyone who lives there. Now, I am not here to tell you where to live. That is your call, and every place has its trade-offs. Language, culture, taxes, cost of living, climate, it all matters. But what I do want you to take away from this video is that the way we do healthcare in America is a choice. It is not the only way. It is not even the best way. And millions of people around the world are living proof of that every single day. If this video sparked something in you, Curiosity, inspiration, maybe even a little longing. Sit with that feeling. Follow it. Ask yourself what kind of world you want to live in and then go see if you can find it. I will see you in the next one.